I wanted to tell you a little bit more about non-alcoholic fatty liver disease. They found that about 10 to 20% of the population has it, but in some studies, they found as high as 40%, and they don't even know it, which is pretty important. Now, you got to remember, the liver is a major detox organ, right? And there's other four organs that actually are responsible for detoxification. There's the liver, the lungs, the kidney, and the skin. All of those are there for detoxification. If one is taken offline or taken off the playing field, the others they have more demand on them, and certain functions that the liver does, no other detox organ does at all. Okay, so the downstream effects of that can be quite substantial if the liver is not working right. Okay, because it has a big job. Now, there's two types of fatty liver disease, non-alcoholic fatty liver disease. There's what's called NASH, which is non-alcoholic steatohepatitis, which basically is inflammation and liver damage in addition to the fat. And it causes fibrosis and cirrhosis and cancer eventually. We talked about, and of course, that can cause permanent damage. There's also non-alcoholic fatty liver, where you get the fat in the liver with little or no inflammation going on, or liver damage. It does not progress to liver damage, but there can be pain from enlargement of the liver itself, which is quite interesting. They don't know why that happens on some people. It may be genetic that some people have that, some people don't have it, okay? But all non-alcoholic fatty liver disease has some type of systemic symptoms. Non-alcoholic fatty liver disease typically always is accompanied by metabolic syndrome. Metabolic syndrome you've heard about before, the high cholesterol, hyperlipidemia, which just means too much fats in the bloodstream, usually high blood pressure, different things of that nature. And toxicity is a major contributor to metabolic syndrome. It's a major contributor. 9 out of 10 have toxicity. That's 90% of those people. Okay, you have metabolic syndrome, have toxins. Now, there's a certain protein hormone that's produced by adipose tissue that actually plays a role in glucose regulation and fatty acid breakdown. And higher levels are associated with lower risk of type 2 diabetes and cardiovascular disease. It's called adiponectin. Because it's produced in the fat. It's anti-inflammatory. It enhances insulin sensitivity, and it's also influenced by obesity, diet, and physical activity. So the best diet, by the way, to be on is one you stick to. That's really the goal, okay? You can't lose weight. It's because of toxicity. You're retaining fat because it reduces the toxicity in your blood. It stores it. It's like a storage area, okay? Now, adiponectin is increased with weight loss, physical activity, omega-3s, sleep quality, and hormonal factors like leptin, estrogen, and insulin. Leptin basically it increases depending on the amount of fat. Leptin is a hormone that when you're satisfied, okay, it increases as you are satisfied, and it goes down if the fat stores come down. In other words, it's just regulating your fat. All right. Now, atherosclerosis increases LDL cholesterol. It increases C-reactive protein, which is an inflammatory marker. It increases homocysteine, which we've talked about before, which is also vasoconstrictive, vasospasmodic, damages the vessels inside. It causes a shift in neutrophil lymphocyte ratios, and that can throw it all. All of that's caused by that. When you see a response in the bloodstream from white blood cells and things of that nature, we know that inflammation is going on. That's what's occurring. The immune system is trying to resolve the inflammation, but at the same time, it's doing damage because it can create clotting, create other problems inside the vessel wall. So it happens in the brain when this is going on, and that's called vascular dementia, where there's a decrease in blood flow feeding the brain tissue because of the atherosclerotic things going on there. And so when a neuron dies in the brain, of course, the brain starts shrinking. And that's where foggy brain, people have talked about, oh, I feel really foggy inside. That's because there's a lack of blood flow going to the brain. And it can be because it's actually a symptom that goes along with fatty liver disease, because fatty liver disease is related to cardiovascular disease. And if you do a volumetric MRI, it actually shows the brain starts shrinking. The space between the cranium and the brain actually gets larger because the brain's actually getting smaller. So they found on research that cognitive disease is associated with this. Non-alcoholic fatty liver disease. It's as an independent risk factor for vascular, or I should say for dementia. Even without cardiovascular disease, you still get cognitive decline as a result of non-alcoholic fatty liver disease. Interesting, huh? And it most likely is because the detox systems are being plugged up and they're not working right and they're backing up. There was a study that was done in 2016 by neurology, and it was they did a test. They did ultrasounds on the liver. And they also did a cognitive test at the same time. And they found that there was an association between those two things, or whether it had cardiovascular disease or not. The cognitive test showed a decline in how they functioned. Now, what's really interesting, NASH, remember we talked about non-alcoholic steatohepatitis, which is just fatty liver with inflammation of the cells. They found the average ALT, which is a transglutaminase. Basically, it's a enzyme, okay, that's found from the liver with disease of the liver, the cells, and they found on average it was 25.7. Now, what does that mean? Guess what? That's still in the optimal range, and there was still damage to the liver. So even though you got it in the normal range, you got to be careful. You got to be looking at these other factors that are involved. And they found that the more of this non-alcoholic steatohepatitis, which just means fatty liver with inflammation, the more there was, the more cognitive decline there was. They also found, which was really fascinating, is they found that fatty livers can affect only certain parts of the brain. It's like region specific. How crazy is that? But we know that non-alcoholic fatty liver disease shoots up your inflammatory response inside your body. If you remember that little commander in chief inside the cells that fires off all the different inflammatory markers in there, it does that with fatty liver disease. They also found that the carotid artery thickness is increased with non-alcoholic fatty liver disease and cognitive decline, which of course, when you have atherosclerosis in here or thickening of the vessel, you're not going to have as much blood flow going up into your brain. All right. Now, I have some pictures for you guys. So let me show you some. You can see it now, right? This is a microscopic one. We looked at this the last time. We saw this. We saw the bile ducts, and we see fat right here, all this. And these other ones are cells. These are the fat cells, and these are the fat in between there. If we look at a real picture of a healthy, so this is a real picture of a liver, and you can see how healthy and shiny it is. And actually, if you looked at liver, if you took a liver, beef liver, and you look at it, it's going to look very similar to that. Fatty liver looks totally different, right? Here's another picture of a fatty liver. This just tells you about fatty liver, right? It's accumulation of fat in liver cells, and in the form of triglycerides. Triglycerides are a type of fat. If left untreated, fatty liver can increase to a risk of cirrhosis and liver disease. And we saw that even with the different types, right? There's one without inflammation. Even without inflammation, it still can cause cognitive decline and reduction of blood flow into the brain. And you can see causes for non-alcoholic fatty liver disease: diet high in fats, sugars, carbohydrates. Not so much fats. It's if you have problems with your metabolic syndrome, then you're going to have an issue with it. If you don't have a problem with metabolic syndrome, you're not going to have a problem with that. Obesity, medical conditions like diabetes, high blood pressure, high cholesterol, hepatitis, obviously. Certain medications that affect the liver, like antifungals and things of that nature, can cause it. Excess iron in the liver. Normally that doesn't happen. If you have a problem or genetic problem, it's called hemochromatosis, where you'll have an accumulation of iron in the liver. It can totally kill the liver. So you don't want to have that. And that's why you should always be checking your levels of iron, ferritin specifically, a storage form of iron. Symptoms: fatty liver has a silent killer because the progression of disease is very gradual. Most patients experience little to no symptoms. Like I said, you can have little to no symptoms at all. You have a fatty liver. Now, here's a trick. The liver does typically get enlarged. If you had fat under your skin, what's going to happen? You're going to get larger, right? And so when you're getting fat in the liver gets bigger. So most of the time you see people, they have the pot belly type thing. That pot belly is a fatty liver, okay? They'll see it start protruding out like, oh, yeah, really protruding. That's because of the liver, typically, all right? There's other reasons it could be, but most of the time that's what's happening. See, 10 to 20% of fatty liver patients develop hepatitis, and that's because that's the other type. We talked about NASH, which causes hepatitis, which hepatitis just means inflammation of the cells of the liver, okay? And when you have those sensitive tissues being damaged, those cells being damaged, that's when you'll start developing fibrosis. Fibrosis is trying to protect the tissues, but it's going to lay down this fibrous tissue to protect those very sensitive cells. A lot of times, even with the non-painful type of non-alcoholic fatty liver, you can have an enlargement of the liver, and it's painful to touch the liver, but you will not have the amount of pain non-symptomatically, or I should say with the actual inflammation of the liver itself. Because you can do it, like even with the test, you may not see as much damage in the liver, even with the fatty liver that doesn't have inflammation, because it's not killing the cells of the liver. Does that make sense? If the cells are inflamed, they're going to start dying, and then you're going to spill off these enzymes that show up in the blood work. So you got to be careful when you're looking at the blood work to evaluate it. You can see here it talks about can occur at any age. Most people ranging from 40 to 50 years old and older. Slower metabolism occurs as part of aging. But here's the diagnosis: medical history review and liver enzyme examination. Remember the different association with different enzymes? You have to evaluate that carefully on there. And a lot of times the doctors don't do all of the liver enzymes that we typically do. Liver biopsy, obviously you're going to be able to see the fat in the liver itself. Ultrasound will also show it. A CT scan will show it. Of MRI will show it. Okay, because you'll see it, the fat in the actual liver itself. See here, when you see waist circumference larger than 40 inches in men and 35 in women, typically indication, especially if you see the waist size bigger than the hip size, that would be an indication. High blood sugar level over 100, triglycerides over 150, low level of the HDL. HDL, again, is anti-inflammatory. HDL below 40 for men, under 50 for women, and high blood cholesterol. Those are all factors, though. If you remember from the previous talks, those are all factors of inflammation, okay? All that's going on. Treatment, basically, there's more to the treatment than this, okay? But you can see exercise is not a bad thing to do. Avoiding alcohol wouldn't be hurtful at all. Avoiding certain medications because it puts more stress for detoxification pathways. But actually getting the detoxification pathways up and improving, that's a big factor with that, okay? Because the liver is not letting this fat get out of the liver itself.